So with PulseCheck's electronic tracking board, we know exactly where every patient is. We know how long they've been in the department. We know the patients in the waiting room, how long they are waiting for a physician initial assessment. And we know what their acuity is, and we also know their chief complaint. And we know that all from a quick glance at the tracking board, which allows us to bring the patients in that are most acute and start managing them quickly. And then the patients that are less acute can be managed in a more prioritized manner. So our wait times have significantly improved over the last 10 years. And there was one point at which we were one of the highest in the province on the lowest physician initial assessment score, which actually got us some additional funding and allowed us to help pay for PulseCheck as well as other vital equipment that we needed. So PulseCheck allows one to create forms that are already templated, and it auto-populates the patient's demographics and the physician's demographics and leaves very little for the physician to complete electronically on the form before it's either printed or it's signed electronically. And this has been very helpful for the agencies that we need to provide these forms to, because they get them very quickly and they get them very legibly. We've done a lot of Canadian customization with PulseCheck. One of those big ones was the electronic Canadian triage and acuity score, which is known as ECTAS. And PulseCheck was able to integrate ECTAS into the overall triaging experience with PulseCheck that makes sure that our triaging is accurate for the safety of the patient and for the benefit of the clinicians that are looking after them. This was a very successful endeavor.